Hi, this is Dr. Richikasahayshukla. I'm Director of India IVF Fertility. So today we will discuss about the topic that why good qualities embryos don't stick during the IVF cycle. This is a very important topic and we need to discuss it today in our fertility series because this is a very important questions many of my patients ask me because I have been doing so many cycles of recurrent pregnancy loss and recurrent implantation failure. So the patient needs to know that they have to be patient and why this is failing if we have transferring grade A embryos also. So coming to it, you just imagine it like a spacecraft is being launched on the moon, say. You must have heard about Chandrayaan-2 right now. So what happens if it is not landing properly? So there might be problem with the spacecraft, or there might be problem with the space terrain, the weather conditions, or you can say the air terminus, the signals that are being given to that. So the same thing can happen. What is the terrain? The terrain is your womb. This is just I'm explaining you to make things simple for you. The terrain is the womb. So if the terrain is not okay, the spacecraft can't launch properly if the spacecraft is very good also. So the same happens if the uterine lining is not good, the uterine volume is not good, or there is less blood supply in the uterus, the uterine factors that you say. So obviously there will be loss of implantation, or if it gets implanted also there can be failure. Secondly, coming to the weather conditions. So this is what hormonal imbalances like medical disorders in the problem in the body. So if you're having any endocrine disorders like hypothyroidism, hyperthyroidism, diabetes, hypertension, uncontrolled. So all these endocrine factors, they lead to this kind of losses. Plus there are immune factors also that are very important because immune factors, what they do, they treat your embryo. So the spacecraft will be treated as a foreign body because of the weather conditions. It is not apt. So same thing will happen, the immune conditions, if they are not good for your body, so they are going to not accept the embryos and they are going to reject it. And believe me, the processes that we do, we cannot completely change your body. So if the machine is also not performing 100%, we can't change the machine 100%. So you can imagine how can we replace your body? It's not possible. In those cases, we can only target towards perfection. And every cycle, because you are landing with one beta HCG report, that is giving us an impetus to run further, because every time it is landed more closer to your success, means more closer to having a baby. Now coming to the air traffic control system, that thing is happening. So these immune systems and other factors like lifestyle factors and all, these are like the air traffic control. And that also we need to monitor. So we tell the patients to practice a definite lifestyle or do so and so things. Now coming to the main spacecraft, that is the embryos. So for embryos, usually the embryologist, if you are having a blastocyst or grade A embryos also, say you are doing a day 2 or a day 3 transfer. So the embryologist can see and tell it. But in some cases, when there are a history of anomaly, defects, advanced maternal age, we definitely tell the patient to go for the genetic screening that we call pre-implantation genetic technique. So if we use PGT, plus we are doing uterine factor things to just do it properly, plus we are doing something immune modulators also we give for suppressing. In these cases, if we go this way, many times the patient does achieve a success rate, and it's not that you have failed once so you will never going to achieve. No, always believe the motto, try again. If at first you don't succeed, try again. It is already a very old thing that I am telling you, and all the IVF couples, they are fertility warriors and they need to follow it, and they need to have this inspiration and patience. One day they will definitely see the light. So have a good day. Thank you. Be motivated. Keep moving towards your parenthood journey. We care about you.